Thank you very much for inviting me to talk at this prestigious society. Today, I'm going to talk about oxidative stress, the ignored key pathology of COVID-19. And this is me, and I'm not going to read about it. And I'm going to go, first of all, give you a few highlights of my talk today. Now, first of all, I will review briefly about the vitamin C and China's anti-pandemic work. And then I will focus my talk on cytokine storm oxidative stress as the key pathology, which is also non-specific in severe COVID-19 cases. But this has been severely ignored. And I think it's a major error in worldwide pandemic management. And then lastly, I will also talk a little bit about integrative also molecular therapies for COVID-19. And first of all, vitamin C has been gaining momentum, popularity in China due to various reasons, and a part of which is our translated work of Dr. Tom Levy's primal panacea into Chinese and in China. And this happened about 5, 6, 7 years ago. And so because of this, and I started giving lectures and talks to academic circles and the general population as well. So there has been some awareness of vitamin C before this happened. And so right about over a year ago at in about late January 2020, as you know, when Wuhan pneumonia at that time was known, broke out in Wuhan. And we realized vitamin C is a powerful antiviral agent. It also has powerful antioxidant capacity in viral diseases. So I talked to my like-minded co-workers, colleagues in China and internationally, and we formed a international high-dose IV vitamin C medical support team. The purpose was to promote, educate, coordinate related works to help to control the COVID-19 pandemic. And as shown on this picture here, this team, we were very honored to have the president of the International Society for Orthomolecular Medicine, Dr. Atsuo Yanagisawa, at the bottom center here, shown here. And we also have Dr. Thomas Levy, well-known worldwide vitamin C expert, on the right mid panel here. And we have Dr. Andrew Sao here at the left lower corner, supporting the effort. In China, we have Dr. Hanping Shi. He is a professor of oncology in Beijing and probably the best known cancer oncologist. And he's been promoting vitamin C and nutrition very widely. And we also have Dr. Cheng from KUMC, as well as Dr. Jeannie Driscoll, well-known functional medicine doctor, and also these two are also vitamin C experts. And so basically, as a team, we also have many other experts from the ISOM supporting this effort, and we've been promoting and educating, coordinating vitamin C related work. As part of the effort, we published a paper back in March 2020. This is around the time when pandemic started going out of China and into to the rest of the world. We published this article, Can Early and High IV Dose of Vitamin C Prevent and Treat the Corona Disease 2019, which received was well received worldwide. As you all probably are familiar with this picture, that this is a 50-ton vitamin C truck, vitamin C powder truck being shipped into Wuhan. As we know from my inside connections in Wuhan, that vitamin C powder was distributed to frontline healthcare staff in Wuhan major hospitals, and every healthcare provider was advised to take a couple of grams a day for prevention. So vitamin C was much more widely used than probably we know of. And also, I was in China at the time, and there are various medical support teams from various provinces to support Wuhan's pandemic. And you see on TV, people were, those nurses and doctors that were packing vitamin C in their suitcases. And personally, I have also given vitamin C powder to some people who were volunteering. They were on the support team to Wuhan. So we do know vitamin C was widely used in China at the time. Actually, talking a little bit back, vitamin C back 18 years ago on SARS, if you remember, SARS hit China and southeastern countries, and vitamin C powder was also used at that time. Now, this is a picture of an old lady with diabetes in Wuhan. She is among the first COVID-19 patients, and she contracted COVID-19 virus, SARS-CoV-2, in late January in Wuhan city. And she's 72 years old with diabetes. She is a high-risk patient. And here on the left side, the patient was in ICU at the time. And on the right side, the patient is here on the second in black. And her daughter here, the first one here in white, she knew about vitamin C. She knew about work. So when the mother caught COVID-19 or started having issues, and before that, actually, she was advising her whole family to take high-dose vitamin C powder for prevention because she knew about it. And she herself was taking about 10 to 20,000 milligrams, which is 10 to 20 grams of vitamin C powder daily. And but mother still came down with cold, fever symptoms, and she's checking into hospital and was confirmed of COVID-19 diagnosis. And long story short, because of the daughter knew about vitamin C, so she asked the hospital doctors to give the mother high-dose IV vitamin C. Well, some doctors did, but not all of them. So the patient was receiving high-dose vitamin C on and off. But long story short, eventually she was healed and recovered. And interesting thing to point out is that when she was on high-dose vitamin C, she improved. When she was off with the symptoms, she seemed to have deteriorated, but eventually she recovered. And this is a picture of her in October last year, which is about 8 months afterwards. She was interviewed by the CCTV Central Television, and this is a screenshot. Also, interestingly, is that her 3 family members, the 2 daughters and 1 son-in-law, were taking care of the sick patient in and out of the hospital all the time. And they were on vitamin C, and they didn't have much protective gear. Remember, you may remember that there was a severe shortage of protective gear in Wuhan at the time, but none of the family members contracted COVID-19. This is another interesting story. I reported this, this case on social media, and within a short couple of weeks, about a month or so, it received 300,000 views, but it was taken down by a major social media, quoting non-compliant with their community guideline, something like that. And these are the pictures on the left panel here. In the center, the man in black. This is a 70-some years old man with severe COVID-19 in ICU on ventilation, receiving high-dose IV vitamin C. Eventually, he recovered. And this is a patient of Dr. Pence. On the right, this is me in Shanghai with Dr. Mao. He was on the expert team in Shanghai prevention, interviewing him, talking with him on the high-dose vitamin C used on medicine in healthcare. So in summary, we and our team, we talked to various medical experts. We talked to the central expert team from Beijing in Wuhan, and we talked to the Shanghai municipal government. We worked with various hospitals and the medical teams in and out of Wuhan on high-dose vitamin C clinical application, clinical studies, clinical trials. And as I mentioned, also that the vitamin C powder was widely used, and with all this. And eventually, we all know now that the Shanghai and Guangdong municipal governments, Guangdong is a province, and the governments formally adopted a high-dose vitamin C into their COVID-19 standard management protocol. As far as I know, these two governments remain probably the only governments worldwide recommending high-dose IV vitamin C. And however we take it, COVID-19 pandemic appeared to be pretty quickly came under control. At least that's how it appeared to be. Now, from China to worldwide. This is a screenshot of 2-3 weeks earlier. But worldwide, COVID-19, as we know, the COVID positive cases has probably exceeded 140 million, and more than 3 million people, more than 3 million deaths were reported. I think these are COVID-19 related or associated, not necessarily caused by COVID-19. But what I want to point out here is on the left lower panel here, the active cases. Out of 20-some million active cases, the vast majority were mild or asymptomatic, and only a very small percentage of those SARS-CoV-2 infected people develop severe and critical COVID-19 cases. Appears to be less than 1%, and that's important fact. And this is a slide from one of my recent talks at the Silicon Valley Health Institute, basically comparing the infection mortality rates of COVID-19 and flu. The data came from CDC and WHO. And here, influenza IFR. Now, influenza is not a reportable disease, so we don't really have the age breakdown IFR. So we have a lump sum together. We know the risk of dying from influenza altogether is less than 0.1%, less than 1 in 1,000. This is for all age groups. For COVID-19, we have age breakdown groups. If we break it down with these age groups like here, newborn to 19, 20 to 49, 50 to 69, and greater than 70, we see the infection mortality rate of people, young people less than 20, very low, 0.003%. Even people in their prime age, 20 to 49, that's 0.02%. So definitely with these two age groups, basically younger than 50 years of age, the infection fatality rate or the risk of dying from COVID-19 is at least at the same level of influenza, not much more than influenza. So the vast majority of people, we should say, and as I said, most of the SARS-CoV-2 infected patients are mild or asymptomatic. So to me, there is no need to panic. COVID-19 spreads very rapidly, but for most people, it's not more scary than influenza. Don't panic. We have to take it seriously, but there is no need to panic. It's important for me to repeat this. Now, when it goes to a higher older groups, 50 to 69, it starts to increase. So 50 to 69, 0.5%, maybe slightly higher than the average here. And when you are greater than 70, that's even higher. Well, that's expected because when you get into these age groups, you begin to have other chronic diseases or immune compromising diseases. So these are the age groups, particularly age 70 and older. As we know also now, people with chronic diseases, they are more prone to develop more severe diseases. We're going to talk a little bit later in this talk. And those are the people probably need to be more protected, take more measures. Now, with all these efforts, and we are glad we received an invitation from NIH to talk about high-dose vitamin C on COVID-19. This was April 8th, over a year ago. And I discussed this very extensively within the ISOM community. And so we went over my presentation. I got, a good very well detailed was the ISOM. And interestingly, I want to say is that out of my 40 plus years in medicine, I've given many talks and lectures, conference presentations, and both here in the United States, in China, and in Europe and other places. I have never experienced, nobody has ever pre-screened my slides in advance, and it happened to this NIH presentation. And because the organizers of this NIH presentation were aware of the sensitivity of vitamin C or the controversy surrounding vitamin C, it probably goes beyond the science, as we all know. So they want to be sure that I only talk about science, but nothing more, and has to be all scientifically based. So I want to present, the point I'm making here is that the NIH presentation data all came from peer-reviewed published journal, and that's important, okay? And so the next couple of slides I want to show you, I didn't update it. I did not update. Why? Is because I want to show you we knew this over a year ago, and still today the message is the same. Of course, I'm going to give you a few updated slides later on. But first of all is that the key pathology of severe COVID-19, we know mostly come from the lungs, the acute respiratory distress syndrome. So basically patients will die of the lack of oxygen. And also we know the cytokine storm and oxidative stress are the underlying universal non-specific mechanisms of severe COVID-19. This is well documented in the literature, and in the paper I published, just showed you earlier, we addressed this cytokine storm and oxidative stress as the mechanism underlying COVID-19. So if we took these measures early on, today we may be different, okay? And not only us, but other experts in the literature as well. So we know cytokine storm, oxidative stress are common to viral infections. As again, like I mentioned, this is not new, okay? Cytokine storm, oxidative stress happens to other respiratory viruses like influenza, human respiratory, syncytial virus, rhinovirus, and the SARS of 18 years ago in China. And increased oxidative stress is a hallmark of COVID-19. We knew this. This again is over a year ago data. And again, here I want to show you cytokine storm is common in not only in viral infections, but also can be induced by certain medications and can happen in certain hematopoietic disease and other diseases as well. And since then, this is of recent, and I did a search with keywords of cytokine storm COVID-19, and there were more than 2,500 papers published by early April. That's about a month ago, within the short 1 year. Okay, this is a well-known phenomenon. If you search for oxidative stress and COVID-19, you still found over 300 papers. Okay, so this again, message is clear, loud and clear. This is a well-known, non-specific, common mechanism underlying many diseases. Okay, if we take measures aiming or targeting this mechanism, COVID-19 can be managed. So let me show you a few. I'll go over that quickly. So this is a slide, a paper of cytokine storm with influenza. This is cytokine storm with hepatitis. Another cytokine storm was viral hepatitis. Cytokine storm with Ebola virus. Cytokine storm with yellow fever. Cytokine storm with viral encephalitis. This list goes on and on. Cytokine storm with HIV. Okay, this goes on and on and on. Okay, so I believe this is a fatal error, not to or unwilling to recognize this important mechanism, universal non-specific. Why is that important? Why do I mention non-specific? Because I see a problem in today's medicine is that every disease we want to specific, or we want to study the unique features of the disease. There's nothing wrong with that. But I want to point out here is that because this is a non-specific mechanism that happens to many diseases, so when the bad disease like COVID-19 broke out, we don't have to wait and spend a lot of energy, time, and studying the disease before we develop some specific treatments while people are dying. Okay, we could have implemented this life-saving measure earlier while studying. Okay, study, I'm not against studying these diseases, but we have to prioritize. When the pandemic broke out, the key was to control it. Okay, this we knew. We knew over a year ago. We knew many years ago, actually. Okay, and why is it important right now? It's not too late to implement, but also very importantly in the future. Okay, we know. We published one paper, and NIH presentation. I also mentioned epidemics and pandemics appear to be on the rise. So in the future, there will be new viral infections, viruses coming out. And I hope we do not repeat the error that happened for the COVID-19 management. And I think hopefully that's a lesson, but I'm not sure if we can. Okay, so also let's talk about COVID-19. Here is a list published, okay? So we see COVID-19 can affect many organs in our body. Am I surprised? No. As we already discussed, this is the oxidative damage induced by COVID-19. Actually, it can be induced by other agents that can cause oxidative damage to the lungs, to the gut, to our nervous system, to cardiovascular system, to the liver, to the kidneys. You know what? It can happen to testicles anywhere. So I won't be surprised. Sure, we can study these, we can report these, but these are the trees, not the forest. We can't see the forest for the trees. We're missing the big picture. Now, next couple of slides are repetitive, but I want to show you oxidative stress is an integral part of the cytokine storm. Okay, so these are, like hand and glove, they're together. So this is one of the best pictures, I think, is that basically the virus coming into the lung, and it inflames, it infects our cells and causing the free radicals and also other inflammatory molecules, the cytokines, and these in turn causing a lot of damages. This is a cascade of events. I'm not going to go through in the detail. So cytokine storm and oxidative stress are part of the whole cascade. And this is a little bit clear picture of the reactive oxygen species, which is the oxidative stress to be integrally part of the cytokine storm reaction. This is a membrane. Now, I think out of the, we know reactive oxygen species can oxidatively damage DNA, protein, and lipids. But I think lipids are of particular importance here. Why is that? Because we know all the cell membranes are mostly made of lipids. So we have plenty of lipids in our cells. When they attack our lipids is a little bit unique. I'm going to show you, I'm going to talk about a little bit about it. Is that, so they, here is a depiction of, basically here's the virus affected the cell membrane, causing a lot of release of reactive oxygen species that causes the inflammatory cell like macrophage illustrated here. And it can, basically this causes the lipid peroxidation, or basically the oxidation of lipids. And this lipids can rapidly cause a chain reaction as shown, well, this is another depiction as shown here. This is the membrane lipid peroxidation chain reaction. So there are two stages in the membrane lipid, any lipid, but a membrane mostly here, is that there's an initiation stage. Basically, the agent here in this case is the COVID-19 virus, the SARS-CoV-2. It initiates the oxidative damage of the double bonds in our lipids in the cell membrane. Okay, and then the lipids, the oxidized lipid becomes a free radical itself. Then it needs to basically it oxidizes all the molecules, mostly the unsaturated double bonds in the membrane. This is so-called propagation. This again in turn becomes free radical and causes further down the stream. This propagation can rapidly happen and in fact oxidize the entire cell membrane and all the cells until it is stopped by antioxidant. Now, what I want to point out here importantly is that because of decades of promotion of highly unsaturated PUFA, basically the fats, in our heart disease, they say that the saturated fats are bad, polyunsaturated omega-6, fats are good. So a lot of people are, using a lot of the vegetable oils. So, and I believe today, we have a lot more PUFA in our. I have a slide to show you. I will talk a little bit more later. But anyway, so this is the same slide of the earlier. Vitamin E is we know vitamin E is a lipid-soluble vitamin, antioxidant vitamin. Why? Is it because it is membrane bound? It's embedded in our cell membrane. So vitamin E is critical in stopping this propagation of lipid oxidation or peroxidation. So when we have plenty of vitamin E, this chain reaction will not occur. Our cells will remain intact, will not be damaged severely. So this is important. Now, here is the slide I was talking about. You can see here the omega-6 PUFA from the 1959 to 2008. It has doubled in our body, in our basically adipose tissue. Okay, so we have a lot more unsaturated double bonds. Those are the double bonds in the omega-6 PUFA. Okay, this is a great setup for our body to react to oxidizing agents like COVID-19. Okay, that's important, but we don't have time to go into the detail today. But let's go back to the antioxidant cascade. I mentioned about vitamin E. Basically, vitamin E, when you have plenty of vitamin E, we are able to stop that lipid peroxidation cascade. But then when the vitamin E molecule is oxidized, it needs to be reduced or recharged. So vitamin C comes in here. It reduces vitamin E. So the vitamin E can go back to the battle to stop that lipid peroxidation chain reaction. But then when vitamin C is oxidized, it needs glutathione to recharge or reduce vitamin C. And glutathione needs NADP, NADPH. So this is a cascade or a system of antioxidant system, not just one molecule. This is one representation of my view of integrative approach. We need to view the system as a whole, not just one molecule. And NADP, NADPH is involved in our energy metabolism, mitochondrial metabolism. Okay, this cascade goes on. Now, this is another depiction, a little bit more complete here. You can see the blue one, vitamin E. We talk about vitamin E, lipid, soluble, membrane bound. Okay, vitamin C is reduced by vitamin C. Vitamin E is reduced by vitamin C. Vitamin C can work with lipoic acid to be reduced by lipoic acid. Lipoic acid is further reduced by CoQ10, and glutathione here. So you see, this is a cascade, part of the cascade of the antioxidant system. Antioxidant is not just one molecule; it's a system. Okay, and as you see here, as I mentioned, is that NADP and NADPH. This is in the energy metabolism. So to make the system work, we need all these ingredients. We need a system, because when you have COVID-19, like in the critical cases, this cycle goes up very rapidly. Okay, and I bet you the critical, and we know COVID-19 patients, we see a lot of richer. For example, in September of 2020, a Spanish study showed 18 cases of COVID-19, 17 of them have zero vitamin C. Okay, let me go fast a little bit quicker. So this is the view of we need to take an integrative, natural, and balanced view. And we need another slide showing balanced. Oxidative stress need to be balanced, not too much, not too little. And so I'm gonna jump a few slides here. And here I'm gonna update a little bit. Dr. Paul Anderson updated on vitamin C in his recent article on Journal of Orthomolecular Medicine. And I'm not going to go over the detail due to time constraint. But I want to show you about the first clinical vitamin C trial in Wuhan by Dr. Peng's group. Here are some the data. Basically, this is mortality. First of all, the good news in China in Dr. Peng's trial was the good news is that the COVID-19 was pretty quickly sort of under control. And the bad news is that the clinical trial ran out of patients. They enrolled only a total of 56 patients that qualified for the strict standard, stringent the standards. And the treatment group received 24,000 milligram per day vitamin C. This is a pretty good dose. Although personally like to see a little bit higher for various critical diseases patients. But anyway, so the mortality measurement did not reach a statistical difference. However, one thing that did stand out is the the reduction of cytokine storm marker IL-6. It was reduced by 8 times, 800%. This is statistically significant, and this adds further proof to vitamin C's ability to reduce oxidative stress and cytokine storm. And here is a picture from his paper of here you see the control group and the high dose vitamin C group. There was no significant the trial, the data was, the number was too small. But what's interesting out of this is that a subset of the patients with more severe diseases appear to be pretty close to, you can see in the picture is that the IVC group showed a lower mortality rate. And again, it was close to, but not quite to statistical difference, but with more numbers, more patients, this will be probably significant as shown in others. And this is a screenshot. I enlarged it a little bit, and this is not the whole picture. But anyway, this is IL-6 as shown here. This is before high dose vitamin C. This is after 1 week after. There's an 8 times reduction. Okay, and also Dr. Michael Passwater summarized on the article published on Orthomolecular Medicine News Service of December last year. Basically, in summary, many other groups of doctors are using vitamin C protocols and reporting good results. In general, that the there's a team in Houston that reported treating over 140 hospitalized COVID-19 patients. Their survival rate was greater than 95%. Dr. Paul Merrick, a well-known worldwide expert on vitamin C, they treated close to 200 patients, reporting survival rate of 94%. And the data from over 460 hospitals from US, UK, and China not using vitamin C protocols, the survival rates have been between 68 and 85%. And as of 4 or 5 months ago, physicians using vitamin C have been increasing worldwide, at least in the United States. And here, the International Society for Orthomolecular Medicine, we've been promoting early on. And this is a paper we published, this is in April last year, May in 2020. We have been calling for protected population immunity. And this is a paper by Dr. Yanagisawa, Dr. Schumacher, and also Mr. Steve Carter, director of ISOM, on the ISM website and the Journal of Orthomolecular Medicine calling for protected population immunity. And this is from that article by Dr. Yanagisawa and Schumacher and Steve. We are now also molecular medicine in a new age. The ILSOM and the related societies and colleagues will promote to make their communities healthier with the slogan of protected population immunity. Optimal nutrition is the medicine of tomorrow, by Dr. Linus Pauling. And in my view, this is important, just briefly, is that we have 3 levels of health. And at the molecular level, or what I call at the biochemical level, is that we need optimally balanced nutrition. Okay, and also we need to have no or minimal toxins or toxicants in our cells. This is the guarantee of a health. Okay, and also here we need to be this is my natural and balanced view. Why? To optimal health at the biochemistry level, like I mentioned, requires the vitamins, the nutrients, and minerals. Those are all natural parts. Our optimal health at the cell level does not require patented drugs for most people. Okay, and this is a concept of protected population immunity, a concept developed collectively at the ISOM. And so basically, I already mentioned. And what I want to say here is why, I mean, while Shanghai and Guangdong have adopted vitamin C as part of measure, but we are having a lot of difficulty to convincing other authorities and the governments to incorporate these nutrition immunity boosting nutrients. And that behooves me, and that goes beyond my understanding. And this is a paper I published on the Journal of Orthomolecular Medicine. To me, the COVID-19 exposes a lot of problems in current conventional medicine. And finally, I want to summarize very briefly how we treat the COVID-19. This is a great book, and it's free. I like to talk a little bit. Hydrogen peroxide nebulization. This is very important, interesting. Again, by Thomas Levy. It's a great contribution to our fight against the COVID-19 virus. In hydrogen peroxide is very safe when used properly. It's quite effective if used properly, very inexpensive and easy to use. And you can download the free book here, okay? And this is my handheld nebulizer. I've been using it for myself, for prevention and for treatment. I never caught COVID-19, so I didn't treat myself for that. But I've been advising my patients in China, and using it. And this is my daughter who contracted COVID-19 recently. She tested positive briefly, and I told her to take vitamin C. And I asked her to take 10,000 milligram, dividing several doses a day, vitamin D3, 5,000 units a day, zinc, 50 milligrams a day, quercetin, magnesium, and also nebulized hydrogen peroxide, 3%. And so first 2 days she was asymptomatic, and the 3rd day she developed congestion, some fatigue. I asked her to increase dosage, particularly nebulization. I asked her to nebulize like 10 minutes and 3-4 times a day, which she did. By 4th day, that congestion was gone. And then fatigue continued. I took her, here's another important message. I told her to continue the antioxidants. Among these, I also gave her what I call total nutrients package. This is a total cell nutrition. This is of my own formulation. It contains all those antioxidants I mentioned, and also the mitochondrial nutrients, including NAC and alpha-lipoic acid. I mentioned CoQ10. Why? Because here, I think I don't have time to talk about vaccine. COVID-19 and vaccine, a lot of problems in my view are oxidative damages. And here, oxidative damage is a common mechanism in many acute and chronic diseases that can cause those we already mentioned earlier, cellular damages, okay? And again, this is, oxidative damage, oxidative stress can cause many chronic diseases here. So if we do not use high and sufficient doses of antioxidants and early on, some of those damages may become irreversible, as shown in this picture from Robbins' Pathology. Today's clinicians tend to forget the basic medicine. So once you come to irreversible, for example, nerve cells, they are hard to regenerate, okay? So that's the point I've been asking for, is early and sufficient dose to quench, to put out the fire, to allows, when the damages are still in the reversible stage. That's very important. Otherwise, you may see long haul and many other problems. Okay. In summary, severe or critical COVID-19 diseases are characterized by cytokine storm and oxidative stress, which leads to cellular and tissue damages. If not controlled promptly, it can leave lung and permanent damage, in my view. And our cytokine storm and oxidative stress is a common mechanism of many viral and non-viral diseases. Early and sufficient dose of antioxidants may be able to block or at least blunt the cytokine storm oxidative stress cascade and should be integrated into COVID-19 management and other diseases as well. A complete antioxidant therapy protocol for severe COVID-19 should include vitamin C, vitamin E, glutathione, selenium, lipoic acid, CoQ19, and other mitochondrial nutrients. I think this is an issue with current vitamin C protocols. I believe many experts out there probably have not really realized this. And I hope in the future we should integrate this, and also like I mentioned, energy metabolism and the mitochondrial nutrients, because they are all part of the antioxidant system. With abundant research data, why is this safe, inexpensive, and effective when applied early and in sufficient doses not being integrated into COVID-19 management, while millions of COVID-19 patients died and continue to die? And finally, I want to thank a lot of people. This is over a year, and again, I already mentioned about this group. I'm not going to repeat. And many of my co-workers in China, I did not on this picture, they helped to promote and connect with these VIPs in the field, in governments, in experts. And particularly, I want to thank here I want to mention, I had a slide to, wait. Well, I had a slide here. I want to thank many of my mentors, my co-workers at the ISOM, and also Molecular Medicine News Service Board, particularly including, but not limited to, please, if your name is not here, that I didn't mean to forget you, particularly Dr. Gonzalez, Schumacher, Ian Brighthope, and Damien Downing, and Dr. Bagley, and Dr. Konode, Ahulu, and Pemberley, and many others. And finally, special thanks to Dr. Yanagisawa, Mr. Steve Carter, and Andrew Kusan, and also Mr. Paul Demita for the support, the invitation, and the coordination of presentation. Together, I believe we can return true medicine to humanity. Thank you very much.